some sad news for you guys. So the video that I was on live with earlier, that was such a good video. It was truly a good video. Didn't work. It didn't work. Instagram did not upload it. It didn't work. I got a couple text messages saying, I can't load your video. And I thought maybe it was just my service. And then I tried to look at it. I normally don't look at my videos when they're posted. Like I don't rewatch them. So I wouldn't know. But I got a couple messages from people saying your video is like not working. It's not uploading. It like paused. I don't know what happened, to be honest. I feel like that is really horrible when I think Instagram should do some type of like backup where it just saves your story or your video. I wish they would come up with something like that, because I always get nervous when I'm on here doing a live video that I can't download it. There's been times that I went to share it and it just dropped, like the app just dropped. And to lose 25, 35, 45 minutes of precious time is not really great. So I wanted to come on. I just got home and popped in the shower. And I said, I really want to go on and do this video because it's really important and it's so applicable. So here we are, hopefully chatting again. And I'm really hoping that this will stick. Fingers crossed. So let's re-talk about what we talked about earlier, which is Justin Bieber. We're talking about the Biebs. We're talking about Justin Bieber. And my reason for sharing this with you guys is because I've been getting a lot of questions from people around my thoughts on what's going on with him, because there are a lot of articles circulating around that he had some type of Epstein-Barr virus issue with the facial nerve paralysis. And people were asking, is that true? Is that not true? Can you comment on this? And I figured, yes, I talk about E.B.V. I talk about herpetic lesions. I talk about this stuff that people were saying, is it true that Epstein-Barr virus can cause something like this? Is it true that, you tested me for this, right? Like I'm a patient that's been in your practice and have had this. Am I going to get something like this? A lot of people were a little concerned about this. And there's actually 2 different viruses that can create paralysis. So for those that, I don't know all the details of Justin Bieber's health history. Justin, if you're watching this and you want to connect and do some integrative functional medicine blood work, call me. I'd be happy to go through this with you. Imagine Justin Bieber called me, you guys. That would be crazy. Oh my God, I don't even know what I would do. The point of the story, though, is that what happened, right? Like the speculation is, why did he have to cancel all his shows? What happened to his face? What happened? Why is there paralysis? There's 2 theories. There's actually 2 theories that I've been seeing floating around on different platforms, right? That's just the way it works. But one of the theories is people are commenting that it was from the jab. People are saying that's what happens when you get jabbed. You get paralysis and nerve damage and weird things, which the truth of the matter is, I posted this today in an email format. If you're subscribed to my email list, you can do that by heading to my website. But I was sharing the common things I'm seeing with C19 2 years later. So we're talking 2 years later, what's been going on with C19. And we're kind of living as we're seeing, right? Like we're seeing things and we're in it. It's uncharted territory to some degree. But I did share that in an email format of the common things I'm seeing in practice when it comes to 2 years past having this virus. What are the common things that are showing up? So if you guys want that article, be sure that you're subscribed to my website, drelisetercy.com, for all that information. However, with this paralysis that Justin Bieber has developed, the thought is it's the jab. There's something in it that created some stress. Another thought process is that it's another variant or a side effect of having C19. Now, I don't know Justin's health history. I don't know anything really about him. I do believe he has an autoimmune condition. If I'm not mistaken, I believe he has lupus. Or maybe Sjogren's. I think it's lupus. I know he's immune compromised, and I do believe I read an article at one point. He did deal with Lyme disease, which is a tick bite, and the tick infests or ingests a bacteria, a spirochete called Borrelia burgdorferi, which is a pretty toxic bacteria that goes inside the body, and it could be systemic. So he's been autoimmune compromised in his background. I know that to be true. To the extent of it, I don't know. But there is some thoughts that people in the medical community are saying that what's happening, and I posted about this probably 2 months ago because I was really sharing my thoughts around this. And long COVID, or people that are dealing with kind of that post-viral syndrome, or those really hard symptoms that seem like we can't get rid of them after having C19, what was actually happening was having C19, or even the jabbed, I won't say the word because I feel like things are still filtered and flagged, but that was causing a robust reactivation of old viruses. So when you get one virus, it can turn on old viruses. And that's the theory. Those are the two theories that have been going on for Justin, is that he either recently had another mutated version of C19, he was really infected, or reinfected, I should say, with another variant, another strain, and it turned on all these other viruses. Now, I would hedge my bets. I'd put $1 gazillion on it that E.B.V has triple-digit E.B.V. Now, there's 4 specific cells that are involved with viral issues. There's 4 in particular. When we order an E.B.V panel, we're looking at 4 specific things to tell us if someone is reactivated, if they're new, if it's the lytic phase, if it's a memory, Epstein-Barr nuclear antigen, Epstein-Barr viral capsid antigen, a VCA, an eBNA, an early viral antigen. There's a lot of different things that we're looking for in the lab work, but I would hedge my bets that Justin has a high amount of each E.B.V titer that we're looking for, which is 4 in total. So I believe what happened was he reactivated this old dormant virus that was sleeping, because viruses are never gone. They're always inside of us. They're just either dormant, quiet, or they're reactivated. The best analogy I can give for this is cold sores. People that get cold sores, when they are in a reactivated state, they get a blister on their lip, right? They get the cold sore. Now that's the virus leaving the nerve, coming down one of the nerve roots, and it's actually coming out at the end of the nerve root in like a hand formation, which is the neuron, right? That's what is happening behind the scenes. We just say, I have a blister. What you really have going on is a viral infection that has traveled from your dorsal root ganglion, aka the virus lives in nerve tissue in your spinal cord, and it traveled down a nerve, trigeminal nerve, and it came out. And it was reactivated. And when the blister is gone, the virus went back into the nerve to live and be quiet. So viruses are never gone. Even C19, multiple people are getting multiple rounds of C19, right? They're reactivating, or they're getting new variations or new different strains. Now, E.B.V is herpes simplex number 4. It's a herpetic. It's in the herpetic family, but there are multiple strains of actual herpes viruses. There's 1, 2, 3, 4, 5, 6, 7, 12. There's a ton of different strains. So my theory is that something reactivated him, and it created the virus, some virus. Now there's 2 viruses in particular that cause facial nerve paralysis. There's more than 2, but there's namely 2. Now he's been diagnosed with something called Ramsey-Hunt syndrome. Hunt syndrome, or Ramsey-Hunt syndrome, is kind of the longer term, which is a partial paralysis from a virus that has infected the facial nerve in the lower motor neurons of that nerve. Okay, so that innervates, that nerve, facial nerve, is responsible for usually the lower 2/3 of the face. Okay, the lower 2/3 of the face. That is a little bit different than Bell's palsy, which some people get a little confused with this. Bell's palsy is a full paralysis of cranial nerve 7, and half the face goes paralyzed. Now, the Biebs may be dealing with just the lower part, which innervates the smile, the nose, the eye, and the eyebrow. Okay, it kind of spares that forehead. We call it forehead sparing. Now, the really scary part of having any nerve paralysis is it can look like a stroke. People wake up and their face is paralyzed and they say, oh my gosh, I had a miniature stroke. You did not likely have a stroke. There are some differentiating factors that tell us neurologists know this, right? That this is not a stroke. This is actually they'll do muscle testing, they'll do dermatome testing, they'll do different sensory and motor testing to see what are we dealing with here, right? They'll have you do different movements with your motor skills, and then they'll also test, different points. But he developed Ramsey Hunt syndrome, which means he developed a reactivated virus that traveled along part of his facial nerve that's causing partial paralysis. Is it permanent? No. Is it partially permanent? Yes. And what I mean by that is there are patients that I've worked with that have come into the practice that have developed this same thing after a viral infection. And Ramsey Hunt is a little bit different than facial nerve palsy or Bell's palsy, which is a kind of, they can show up a little different, but they look very similar. Okay, you also can get lesions in the ear, you can get ear pain. There's a couple things that can happen that can differentiate which version we're dealing with, but they're generally the same. You guys don't need to know all the specifics. The only thing I want you to know about is if you're like, I'm really confused, the only thing you can take away from this is that viruses travel along nerve roots, and they're called neurotropic viruses. They're viruses that love the nervous system. Now, one of the classic conditions that a lot of people know about that is kind of like under this category is multiple sclerosis, MS, people that have the demyelinating condition where they're losing the myelin sheath that covers their nerves. How does that happen? You may have had neuritis, or optic neuritis is traditionally like the first thing that happens. It's the small baby muscles that go first because they have less myelin. They're not as bulky and big, and that's where we get some issues. We can have our fine motor hands also have problems there. The overlapping thing that I'm sharing is that viruses love nerves. E.B.V is clinically implicated as a causative agent behind MS, as is Epstein-Barr. As is it in the same case of Ramsey Hunt and facial nerve paralysis. Now, the paralysis, what I mean by it when I say that it's partial, is that it could take weeks to fully rectify, and there are instances where it doesn't fully get better. Now, it may not even be outwardly visible to an untrained eye, but to a trained eye, when you're looking at someone's face and they can't move maybe like a small part of their smile, when they're smiling, they're like, this side seems to be even just like a millimeter or a centimeter down. They are like, that's weird. I never had that. I'm noticing my smile's not the same. This is just an example, but this could happen with the eyes as well, or the nose. Well, it's the lingering effects of the muscle paralysis or the nerve being irritated that cause the muscle paralysis. Nerves innervate or provide nervous system stimulation to tell the muscles to move. We have sensory nerves, we have motor nerves. Sensory nerves are, can I feel that you're touching and poking? Can I feel sharp? Can I feel dull? Can I feel temperature? That's sensory. That's a different pathway. Motor is the movement, which is basically, can I chew? Can I get activation there? So the E.B.V has reactivated either Epstein-Barr or Varicella Zoster virus, and that has caused paralysis in his face. Why everyone's asking me about this is because they know my claim to fame, and I talk a lot about this, and I've even been given feedback that you're the only doctor that I've ever worked with that's ever talked to me about the clinical implications and problems that arise with chronic reactivated E.B.V. It's not really talked about in the conventional medical model. It's really looked at in more of the functional medicine space, and there are specific people that really help to guide us because it's a very specific topic, right? We go to neurologists for the nervous system. We go to gastroenterologists for the gut. Dermatologists obviously specialize in the skin. Each of these ologists has a thing that they work with. Well, there's not really a great doctor for E.B.V or for reactivated viruses. Usually infectious disease doctors would be that kind of doctor. There's not as many of those people around. Holistic doctors, functional medicine doctors, someone like myself, we do care about like cytomegalovirus, Epstein-Barr, Varicella Zoster, herpes zoster. These are all viruses that can cause partial paralysis. Now, we don't know exactly yet, was it the jab that activated old viruses? That's a real thing that happens for people. People that developed long COVID or that drawn out chronic fatigue, it wasn't because of, I said the word. Damn. Hoping not to say it. It wasn't because of C19. it was because reactivation of EBV or mitochondrial viruses that are energy depleters like EBV. EBV depletes energy. So you make a cell, your cells make energy, your cells make other cells, and they make machinery, and EBV goes, thank you, it steals your machinery. Okay, it works at the level of the mitochondria, and it creates dysfunction. It creates a whole issue with the interleukins and the cytokines and the way our innate and adaptive immune system react and respond. It's no joke. Now the organs, there's two in particular that EBV loves. Well, actually, I'll say one of them's an organ, one of them's just an area. EBV loves neck up. This is the area. If someone's going to be dealing with problems with this virus, this is the area they're going to be dealing with it. And what I mean by that is the thyroid gets affected. Okay, the thyroid gets affected because that's the area in which viruses go to. Every virus has associated organs that it bothers. So for example, women that have HPV or women that get tested, right? Women go for their exams, they get tested for HPV. Where does that virus live? It's really in the cervix, right? It's in the vaginal canal. Where did C19 go? Lung. That was its claim to fame. It was respiratory, right? Where do cold sores come out? Lips. Okay. Each virus picks and chooses its player in the game. So EBV loves neck up, which could be the thyroid, the lymph nodes, the glands of the neck, and the nerves of the face. It also is systemic. It can go anywhere. It doesn't just have to live neck up, but that's really the area that people describe as the symptoms that they experience outwardly when they have this type of viral infection. Is they get chronic sore throats, they get postnasal drip, they do have Hashimoto's, they have autoimmune thyroid attacking the gland, they've got lymph nodes that are very palpably painful or that have been ultrasound or sonogrammed, right? Like I send a lot of my patients for sonograms or ultrasounds of the glands of the neck when I'm palpating or feeling around, and I say, I don't love how that feels. I'm looking for the anterior cervical chain lymph nodes, the posterior cervical chain lymph nodes, and then I'm looking for a grading scale. I'm looking to see if they're malignant to some degree or if they're problematic based on the radiology report that I received back. So it loves this area. It also loves the nerves, right? So that's really what's happening. Is the whole point of this video is people were asking my commentary and my thoughts because they're like, oh my gosh, I'm reading all this stuff about Justin Bieber having this paralysis, and I believe his wife did as well. What's going on? They're mentioning Ramsey Hunt. They're mentioning some form of EBV. They're mentioning a lot of things that you've talked to me about. And they're wondering, am I going to develop this too? Is this a new symptom of long C19? And the answer is, we don't know enough yet, right? We don't know. Was it just the jab? Was it the jab reactivating something? Was it a combination of both? Was it because he's already walking around with an autoimmune condition which makes him weaker? You know, I imagine that we all have shields. We all have armor around us. And if we have a shield that drops down, we're not protected anymore. And so now we could pick up different viruses and different stressors and bacteria and mold. And there's a lot that goes into that. It's so difficult to say why someone develops this. There's genetics that are coding for these things. There's environmental factors. We don't know why someone develops these things. There's trauma, right? Childhood trauma can cause some stress. EBV, someone's asking, sorry, what's EBV? E as in Edward, V as in Victor, B as in Beck. EBV. We're talking about Epstein-Barr virus. Epstein-Barr virus. EBV is the name of it. I said that backwards. But if you're interested to know more about this specific virus, I have a ton of content on my YouTube channel. You could just search for me, Dr. Elise Terzi on YouTube. I have videos dedicated to just EBV. So we're talking about, if you're just joining, I see a couple of new people popping on, my thoughts on what's going on with Justin Bieber. I'm saying Justin like I know him. What's going on with Justin, right? Like I know him. Justin, wow, this is what's happening. I would recommend, right, if Justin Bieber called me, I would say, Justin, we need to do a lot of revamping of your body. I want comprehensive blood work. I want to start there. I want to look at viruses and pathogens. I want to order an HSCRP marker for you. I want to order an ESR. I want to order inflammatory markers. I want to look at your complement cascade, your C3A, your C4A. I want to look at your glutathione levels. I want to look at mycotoxin poisoning. I want to look at heavy metals. I want to look at Lyme. I want to look at Bartonella, Babesia. I want a full, thorough blood workup on you currently. I want to know what you're taking pharmaceuticals and even natural things. I want to know your lifestyle. I kind of know his lifestyle, right? It's probably really stressful. He's under a lot of pressure. He's under a lot of scrutiny. I mean, being in that limelight is probably really difficult. But that is what I would do. I would start with lab work. So if you're a little concerned, in my invitation, this was the article today, if you're like, something is not right after C19, like something just isn't right or something is weird, a lot of new skin reactions are developing, people turning on autoimmune titers in their blood work, get your blood tested with a functional medicine blood profile, because these are not course of standard care tests. You're not going to go to your primary and they're going to, do these types of testing. That's just not the way it works. So you have to find someone that practices or honors that these viruses and other things are factors. And that's really the best thing to start with. Oh, thank you, Willie. You look so beautiful. Thank you. I'm fresh out of the shower. It's really hot today. It's very hot, very humid today. It's probably like 85 degrees with like 99% humidity right now. So I love summer because you get to air dry, no makeup, fresh face, everything feels clean. But that would be my invitation, is have someone do the functional lab testing with you. And then what do you do? Now, classically speaking, in the medical model, he will likely be prescribed antiviral pharmaceuticals like Famvir, Acyclovir, Valtrex, Zovirax. All those are antivirals. So when the virus attempts to replicate, it doesn't know how to do that because these antivirals stop the reading of the virus. The virus goes A, B, C, D, E, F, L. It just drops the ball, right? It can't do that. There are some side effects to using some of these antivirals, and the truth of the matter is sometimes they don't work for people. That's one of the things I've noticed, that people in my practice, patients that have shared with me, they're like, oh, my doctor prescribed this for my chronic fatigue because they said it was reactivated E.B.V, and I was on it for 4 months and it didn't do much. It's because they're only looking at one thing, which we need to also understand. Why did you get the virus? What allowed that to come to you? Where else are there problems in the body? Is it inside the liver? Maybe there's stagnation in the liver. Maybe you're not emulsifying your fats appropriately. Maybe you're having problems with what's called conjugation, which is how we make things less toxic in the body. So sometimes when someone's doing, when they have a problem and they take a very linear approach, this is your problem, here's your solution. Unfortunately, that method doesn't really work because there's other outside factors that are affecting why someone has a virus. So just to give you an example, cortisol, right? We all know about cortisol. It's actually really supportive anti-inflammatory hormone. When we overproduce it, it becomes pro-inflammatory. So it changes the way it works based on the amount in the body, right? Something that's good for us is good for us, but more is not more, right? Sometimes we think taking more of something is going to help me quicker and faster. Not necessarily. That's not really the way it always works. So the point is that they'll give him some type of antiviral and the paralysis will likely clear up. But it may come back, right? The virus may reactivate again because they're not really addressing what other factors are allowing his immune system to be so disrupted that all these viruses come in him. Now, we would, in my practice, in my business, and the way I work with my patients, is I would want to know everything about him, not to be nosy, but tell me about your diet. Are you eating a diet high in arginine? Are you eating a diet high in things that replicate the virus? Certain foods are high arginine, right? Proline is an amino acid that's found in a lot of animal sources, and sometimes that is creating depression for people. There's a lot of things that we can look at. We love L-lysine, which is an amino acid that actually stops viral replication. So there's a lot that we can use as the natural antivirals, but also checking to see what's the integrity of the liver, right? Do you have enough glutathione, which is really good for phase 1 through 3 detox inside the liver, which the liver is a giant immune organ. It's a huge lymph node. Is this like a Bell's palsy? This is very similar to a Bell's palsy. Bell's palsy and Ramsey-Hunt syndrome are almost synonymous. They're slightly different with the origin or the etiologic factor or the virus that creates the dysfunction. Bell's palsy is typically the whole side of the face gets affected. Ramsey-Hunt is usually just the lower quadrant of the face gets affected. There are different viruses that can create the dysfunctions, but they're very similar. For the sake of making it simple, they are the same. We'll just call it that, right? I don't want you guys to get so overwhelmed that it's like I tuned out because I just can't call it the same thing. My daughter got chronic hepatitis B. Yep. So that would be something inside the liver. So if someone, there again, you could, so let's just use this gentleman's example. My daughter got chronic hepatitis B, and then maybe your daughter also developed E.B.V, right? If you just treated the E.B.V, you haven't addressed the chronic hepatitis B that allowed the E.B.V to crop up. You haven't gotten the root or the core. We haven't unraveled like the layers. And so that's really what I would be interested to know about, is a whole workup. Is there a cure? The cure is to work with a functional doctor who can guide you as to all of the pieces of the puzzle that are required for a healthy, optimal immune system. The immune system is so freaking complicated and complex that there's no one answer. If it was that simple, he would have taken his antivirals. He would have just gone on with his life and never posted about it and continued his tours. He also, like I said, Justin also has these immune stressors, like I said, lupus. I don't exactly know all of his health history, but there is no one simple solution. It's very, very complicated. Isn't arginine good for weightlifting? I know it's not good for people with viruses, but I take arginine as a part of my daily supplement. Arginine is a vasodilator. It opens the blood vessels. And you'll find like things like nitric oxide and arginine-rich products. Arginine helps boost nitric oxide. They are in the bodybuilding space. You'll find them utilized. They're just amino acids that are in the bodybuilding space, but they would be contraindicated for someone that has viruses, because think of it like this. You're a bodybuilder and you want the best body out there, right? You want to feel amazing. You need a ton of energy to get up to lift. You need a ton of energy to just push through all those heavy movements. But you think arginine is going to give you that energy because it's going to open the vessels and bring the blood. No, you're actually going to reactivate the virus, which is going to drop your energy level. So this is where it gets complicated, right? This is why it's not a simple, I wish I could just tell you, take this, don't do that, stop this. No. It's really, really complicated. So in this specific instance, if I was dealing with a bodybuilder that had overwhelming viral issues, would I recommend using things like arginine in their daily life supplements? No. And that's what I would want to know, is what are you taking? What are you using? What are you eating? Arginine is found in foods, things like peanuts, chocolate, very high arginine, right? There's a lot in that can replicate the viruses. Even things like oatmeal. Oatmeal actually can replicate E.B.V and specific viruses. I won't say it could replicate it. It could replicate it if it's there, right? If it's a problem for someone. So these are all really great questions. I love that you're asking this stuff in terms of the clinical component, and I wish I could just give you like a simple, direct answer. But it's, there's a lot that goes into this stuff. There's people like me that we go to school to learn about this. We have to dive into this in depth. So that is my take on Justin Bieber's ailment. I know he'll get better. Justin, if you're watching this and you want help, call me, right? Call me. I'm sure he works with some really amazing functional doctors. If you don't, you better get working with them, because they would really, really help a lot of these autoimmune conditions. And as much as I'm so sad that this happened to him, I hope that he can use his platform to create awareness, and maybe this opens exactly like a conversation for other people to learn about this. And if he's the reason for that, then maybe it's a blessing in a little bit of disguise. Not to be TMI, but I heard arginine is good for male health. Well, it is. If you're thinking about what is vasodilation, it opens the blood vessels. So if you're talking about things like erections, right, that is a vasodilation process. You have to bring blood into part of the female reproductive tissue, male reproductive tissue, and that's how it engorges with blood. You bring blood flow, just like you bring blood into the arms, the biceps, same concept. Okay, it does open the blood vessels, but that's not always the first. We kind of triage, right? Like if the house is on fire, we're not going to do laundry right now. So it doesn't mean you can't take arginine. It doesn't mean you can't bodybuild. It doesn't mean you can't do all that. It's just maybe not right now until we rectify the problem, and then we can go back to some of those things. So when we work with like healing, it's not, this is the way you have to live forever. There may be a couple little tips and tricks there, but it's usually just in the kind of short duration moment. anyways, that is all I wanted to talk about. I hope that gives you guys a little bit. Gosh, I'm neurologically switched today. I could feel it. I'm like stumbling on my words and saying things backwards. It's called neurologic switching. But I hope that clarified some things that you guys were interested to know about, that you're like, Dr. Tersa, you talk about this all the time, and Justin Bieber has this. Tell me what's going on here. I hope that helps clarify, and I hope this video posts. I did this earlier. I feel like I went into so much more detail in the video earlier, but it's 7 o'clock at night. I kind of want to unwind a little bit, but prayers it posts. If it doesn't post, I'm not posting this again. So anyways, guys, thank you for tuning in. Thank you for your questions as per always. And if you're dealing with some type of chronic ailment after C19, connect with someone like myself who can guide you and support you and respects and cares about these things, and you're not being dismissed, because a lot of this stuff is not talked about. We got to start having these conversations in terms of this. So I'll see you guys in the next video, and that's all. Goodbye.